Hello everyone and welcome to the executive team question and answer session on the first day of December. So we've gone through the last year quite quickly. Today on the call we've got John Brewin and Anne-Marie Newham and Jen Guiver. So I'll now hand over to John to do a bit of a welcome and introduction. Thank you, John.
Thanks, Yolanda. Welcome everyone. Good to see you all. I hope you're managing amidst all the challenges that we've got going on at the moment. Just a couple of headlines to speak about. Well, my screen's gone all funny. I don't know if that's I'll keep talking until someone tells me not to.
Yeah, it's fine, John. You look clear to us and everything seems fine, so just keep talking. We can see you clearly.
Thank you. Yeah, so pandemic, bit of a surprise, I think, over last weekend with the emergence of this new Omicron variant. There's some specific questions coming up on it. The bottom line at the moment is, in terms of some of the detail, is there's still a very significant lack of knowledge about the transmissibility, the infectivity, how effective the vaccines are against this new variant.
What's happening?
Tomatoes.
Can you switch your microphones off, please? Just check. Thank you. And I'm sure that information will emerge in the coming weeks. And you can tell already that there's been quite a significant change in tone and level of concern nationally, and we'll cover some of that through the Q&A later. The most important things still remain in terms of protecting ourselves and our patients and service users with regard to social distancing, to use of PPE, to making sure that we're lateral flow testing and being as safe and considerate as we possibly can. So thank you for everything that you're doing in that regard. The other thing to say, which again is a bit of a statement of the obvious really, is how busy everywhere is. You'll know that from your own services that you're in or that you're supporting, but also right across the health and care system. Things are really starting to ramp up as we move into winter. Emergency departments, primary care, ambulances, all exceedingly busy, as are many of our services. And I'm sure that's going to continue for some weeks to come. Just a bit of something that might be less at the forefront of everybody's minds, something called the ICS, which is a number of us are spending a lot of time working in the integrated care system. So that for the county of Nottinghamshire, the Nottingham and Nottinghamshire ICS moves into something called shadow form from the 1st of January. So that there is going to be a very significant change in senior teams, levels of accountability and reporting as the CCG ceases to exist in April. So all the things that are replacing that and the mechanisms that underpin it are going to move into shadow form from January. So we'll keep people updated as much as we can. I know people are interested, and there are lots of opportunities for trusts to increasingly work together, particularly around where we have got shared patient pathways. So look out for that as we move from January into the spring. The landscape is going to be different, and there'll be lots of new 3-letter acronyms for us all to learn and commit to memory. And the final thing to flag is the work that Sarah Furley's team is leading, our Director of Partnerships, around the strategy, the new trust strategy. There's been a big engagement exercise across the trust, which many of you and your teams have been involved with. The response to that's been really positive, really strong. Lots of inputs into our strategy and planning and thinking about, okay, so what's the trust going to look like in 1, 3, 5 years time? and we'll start collating the inputs of that, and you'll be seeing that described in the new year. Thank you for your contributions. And then finally from me, Yolanda, before we move into the Q&A bit specifically, is again just to thank everybody for what you're doing. We do appreciate it's tough that just managing rotas on a day-to-day basis is difficult, and the sickness is high, and the uncertainty and concern about this new variant and the pandemic more broadly, really challenging times for us. So a huge thank you to everybody for everything they're doing. That's me, Yolanda, for a summary roundup to kick us off.
Thanks, John. That's much appreciated. And I'm coming to you with the first question. And I'd just like to remind you, John, that the call, not everybody on the call is clinical, so be very straightforward and simple with your response, if you wouldn't mind, and not too clinical and technical. So somebody's put in a very simple question, but I'm sure it's quite a long answer. How much do we currently know about the Omicron variant, please? Yeah,
so that is a good question, and I've got some stuff in front of me. So the bottom line, to move away from clinical jargon, is that we don't know a lot about it at the moment, and those key areas about how transmissible, so how easy does it pass from one person to the other, what level of severity of disease does it cause, how effective are the vaccines, how effective are we at identifying it in the tests that we use. There's not an awful lot known about Omicron variant at the moment. Remember that this is an approximate number, but well over 90% of all the cases in the UK have been the Delta variant for some considerable months now. So researchers in South Africa sort of alerted everybody first, although there's probably a view that it's been around but not identified in other countries for a while too. And people will have seen the response in terms of restricting flights and all sorts of other responses with regard to mask wearing, etc., etc. In terms of how quickly it spreads, there is a view that it may well be more transmissible and can spread more quickly from person to person. In terms of severity of disease, this is where it's at the moment the data doesn't really isn't able to tell us, because although in South Africa the rates of hospitalization and death have increased, that's because there's been an increase overall in the number of COVID cases. So that increase isn't specific to the Omicron variant. And again, there's another narrative that suggests that whilst it spreads more quickly, it's less of a severe illness or infection compared to the other variants. But that will all come out in the wash in the coming weeks, and we'll be able to get greater clarity on that. There is evidence, though, that even though someone may have been ill with COVID with, say, the Delta variant, that they are not immune to Omicron. So there may be an increased rate of reinfection. And again, the question about effectiveness of vaccines, currently can't answer that specifically, although it's true to say that the current vaccines are very effective across all the variants that have been identified so far. And although this variant has an increased number of mutations on that what's called the spike protein, there's still a sense that there will be some protection offered by the vaccines. More on that as we get data to share. And then the final thing is around the use of lateral flow, and PCR tests continue to use those and do those. They are able to pick up positives when it comes to Omicron. So that the overall message stays the same, Yolanda, in terms of the most effective things that people can do. It's all those things that I mentioned at the start. Sorry to be repetitive about it, but it does protect and reduce the chances of people getting ill. Keep your distance, keep ventilated. If you're in rooms with people, wear masks, where appropriate. You do your hygiene. And apparently there's one here that says if you're going to cough or sneeze, do it into a bent elbow or tissue and get vaccinated. There you go. Thank you.
I think that's pretty much all the key messages, John, but I'm sure when Anne-Maria gets an opportunity, she'll be reinforcing it even more. Sticking with you, John, there's a supplementary question that we've had about whether you can give an update on what national guidance we've received as a healthcare setting in terms of COVID-19 and the new Omicron variant.
Oh, I've just switched off my my script sheet. Anyway, this is important to distinguish between national guidance, which is fairly generic, and specific health, NHS or health and care guidance, of which we've not had anything specific yet, but we are expecting some later this week. So people will have seen, I've alluded to it already, some of the specific things that have changed in terms of travel requirement, changes in terms of testing, either on leaving or return, coming into the country. The use of masks in England has changed and come into line with Wales and Scotland and Northern Ireland about wearing masks in public, but not all public places. Really important to check out what's on and what's not on. As I've just clicked off my answer sheet, I can't read that out, but I'm sure Anne-Maria will remind us about, there are, I know supermarkets, for example, where public transport masks will now become compulsory, so just watch you don't get caught out on that. The other major change to the national guidance has been to do with access of vaccines. So you'll have seen on the news most days that the gradually increasing number of boosters that people have had and which cohorts are in line to receive them, and essentially that's been ramped up massively. So I think the Prime Minister said yesterday or the day before that the aim now is to get everybody that's eligible a booster vaccine, so that will be their third vaccination, and by the end of January, which doesn't give us very long from an NHS perspective to get that done, and puts another sort of big ask into all those vaccination teams, both in hospital hubs, in vaccination centres, in primary care, GP land, and in community pharmacists to really ramp up the numbers of people that are getting a jab. However, it still remains the case that although they've reduced the time between the second vaccine and the booster, you don't need to call them. You will be contacted to when your booster is due in good time. So again, just watch out for that, and we continue to strongly recommend. It's one of the most important things you can do to protect yourself and also protect your family and the service users that we care for. I think I've covered most things on that. Yolanda, thank you.
Thanks, John. And as always, your sidekick Anne-Maria will pick up anything that she thinks you've missed off. I have sent you your notes again, John, on email. So if you get those open, ready for the next time we come to you for a question, that would be fabulous.
Thank you. Thank you.
Anne-Maria, moving to you next, if that's okay. And I know John's probably covered some of this, but they're asking about what plans are there locally to implement the new guidance following the recent government announcements. Thanks, Anne-Maria.
Oh, thank you, Yolanda. Yeah, my name's Anne-Maria Newham. I'm the Executive Director of Nursing HPs and Quality. So John's just done a really good resume of what the national changes are. And I think the question really is about what we're going to be doing locally. Well, I just wanted to emphasise one thing. Nothing has changed with regards to healthcare. Nothing. Okay. So when Boris did his fabulous announcement on Saturday with Chris Whitty, it was in relation to what we do in our public social lives. Okay. So that's walking into the supermarket with a mask. That's walking onto a train with a mask. However, with regards to any changes for ourselves, there is nothing. We are continuing to social distance. We are continuing to wear masks. We are continuing to ventilate our rooms. The only thing I can say on this is that I can't say to any of you that when you walk out of work, whatever time that be, 10 p.m. at night or 7 a.m. in the morning, I can't say to you, you need to adhere to what we do in healthcare. You know, you are really responsible adults on the whole. And so I just feel that it's about some personal responsibility in this. And I would like to think that if you are going to be doing anything around Christmas or anything coming up at work, that you will continue to adhere to things whilst in work, but also be sensible outside of work. What the recommendations I've been given to people is still wear your mask to wherever you're going to go. And then, of course, you know, you are going to be taking your masks off. You're going to be going for food or for drinking or whatever it is. So I can't say to you, you've got to do those things. The other thing I'm saying to people as well is if you're going to go to something, do your lateral flow test within 48 hours of going to the event, because we are still picking up people and staff that are asymptomatic, and we are picking up positive lateral flows through that way. And that's really important because it has helped us to reduce the spread in the organisation to our patients and then back to our loved ones as well. So I just wanted to say that from a local guidance, we've had nothing new. The vaccine programme is out there. We've got the flu programme out there. Everybody will be offered a vaccine by the end of January. I know it's very ambitious, but I think that it's something that will protect us all and we need to do that. But at the moment, I think, yeah, that's pretty much as I can say, really, Yolanda, unless there's anything anybody would like me to answer.
Thank you, Anne-Maria, that's great. Sticking with you, Anne-Maria, we've had a three-part question, which I think part A comes to you, and then there's two more parts to the question, which Jen will cover off after you. So the first part of the question, Anne-Maria, is asking whether we've been asking our vaccination teams to aspirate the needle before injecting the COVID vaccines.
Okay, so in the olden days, when I started nursing, it was a big thing. You always aspirated. You always needed to make sure, it didn't matter where you put the injection, you always did a little bit of an aspiration. The world has changed. And actually for the COVID vaccine, we've done some really, really stringent evidence, and we've gone from the national requirements. We do not need to aspirate when we give the COVID jab. Okay, that's really, really important. We do not. It's a no aspiration technique for COVID vaccines. I'll give a little bit more of an in-depth, because I love a bit of in-depth, and I think you'd all miss it if I didn't give you some data. But IM injections should be given with the needle at 90-degree angle into the skin, and the skin should be stretched, not bunched. It is not necessary to aspirate the syringe after the needle is introduced into the muscle, and that's from WHO. Also, there is no mention of needing to aspirate an IM injection for COVID vaccines in the Green Book, of course, which all of you know that we're using. And also, if anybody does think that we should be doing something different, just come back to me and tell me where you've seen that from. Because like I said, we've moved away from aspirating for any IM injections in that way.
Thank you, Anne-Maria. A really comprehensive answer. And for the non-clinical members on here, we've all learned something, I think. Moving over to you, Jen, if I could ask you to introduce yourself when I hand the microphone over to you. But the question has been asked about, now that we will be making the vaccinations mandatory, subject obviously to parliamentary process, are we aware of any contradictions in employment law of making such a demand? And have we considered the legal obligations to staff under current employment law? And again, please keep it quite simple for most of us. Thanks, Gwen.
So hi everyone, I'm Jen Guiver, I'm Deputy Director of People and Culture. So the first thing to stress, which I know has been said on previous Q&As, is this is a legislation change. So it's not something that the Trust can choose to implement or not. So we will be implementing the legislation, and we will also be implementing it in line with the national position on this. So that brings me on to the employment bit. So you probably all have heard of Agenda for Change or the medical and dental terms and conditions. As an NHS, we're all employed under national terms and conditions, which are negotiated by an organisation called NHS Employers. So they sit and negotiate on things like the pay deal, on changes to Agenda for Change, and currently that's what they're doing on our behalf as employers around the employment aspects of the legislation change. So imminently, I really hope within the next sort of 24, 48 hours, we're expecting the guidance implementation guide to come down from that national team. And that will essentially hopefully look like a draft policy that we can use for our own trust. And that will cover off all the employment considerations and employment law issues that this new legislation could throw up. So essentially, that's the answer to that question, I think, Yolanda.
Thank you, Jen. That's absolutely great. Thank you. Anne-Maria, I am going to be coming back to you, if that's okay, Anne-Maria, although it's more of a facilities related question, but it does relate to COVID still. It's quite a long, detailed question, but it's somebody who's a new starter to the organisation and also working on one of our sites. They've mentioned that when they work on site, they've used different entrances coming into the building, and were concerned that they couldn't see any face masks or hand sanitisers available. So I know that we've sort of sorted that out, but could you answer the question, please, about whether there is a supply of mini stations installed at our entrances at least, and also what we want staff to do if they are aware that something's run out. Thank you, Anne-Marie.
Yeah, no problem at all, Yolanda. I think in the first instance, I just wanted to say, as a new starter, I'm really, really sorry that you came across that, because I know that it's a little bit on the scary side when you don't know where everything is. I always used to say to a lot of people, especially on induction, I used to say to people, being a new starter, you need to really kind of like look after them, and particularly when you're new or a student, because you don't know where everything is, you don't know where the kettle is, you don't know where the toilets are, and this is a similar situation. So huge apologies. I know that this has already been raised with our facilities team, and I know that they've already addressed having mini stations at our entrances to the building. Now, there are a lot of entrances to DMH, which is Duncan Macmillan House. There are a lot of entrances, so it should be remedied and it should now be in place. But if that person still sees that there isn't anything available or it's run out, then just get on to the facilities helpline, and they will sort it out for us. But again, I think it's all right, like to raise it with your own managers or your own line managers as well. Or if you see something personally that needs to be restocked, whether it be gloves or masks or sanitizer, whatever it is, then it's okay for you to also dip in and make sure that those areas are supplied.
Thank you, Anne-Maria. And I've put into the chat, there's an area on Connect with all the relevant facilities service desks, email and phone numbers on. But I've also dropped into the chat the one for Rampton and the one for DMH, Duncan Macmillan House. We've just got one more question before we turn to John for summing up. And the last question, Jen, is a very important one. It's about annual leave, and are we allowed to carry over any into the next annual leave year? So if I could hand over to you to answer that question, Jen, that would be great. Thank you.
Yeah, so just a little bit of history so people understand the context. Prior to COVID or pandemic, Notts Healthcare's annual leave policy did not allow for carryover of leave. And we put a derogation in place during the pandemic to allow 5 days of carryover and 10 in exceptional circumstances. And we all know the reasons for that. People were unable to take their leave, etc. What we have made a decision on now as a senior leadership team is we would like to take that forward and actually amend the policy that's in existence. And to be clear, That means that staff can carry over 5 days of annual leave with the agreement of their manager. The reason I give that caveat is that it's really important that everyone does take a break. I know myself that had months where I didn't have a break, and then having a couple of weeks off with the family really did me some good. So it's really, really important, and it's everyone's responsibility, managers and their staff, to make sure that opportunities are given to take leave. We wouldn't want people to be in a position where they can't get a break. So the optimum position is you do take your leave. If you're unable to, we can carry over 5 days, and 10 with sign off of the head of service or the general manager for the service. In terms of practicalities, I've been asked a lot whether ESR will do it automatically. Yes, we've set up ESR that the 5 days will go forward, so there will be no need to be emailing the ESR team to ask for up to the 5 days to be carried over. However, if there are people who are approved the exceptional 10 days, anything above the 5, and that's pro rata for part-time staff, we'll need to email the ESR team directly at the end of the financial year. Last thing to say is that it's really important at this point, we're at the start of December, that you get onto ESR and eRoster. If you're on eRoster, make sure your leave record is up to date. So you've inputted all the days that you did have off, any that were cancelled for whatever reason are amended, so that you know where you are in readiness for the end of the financial year, and that you do have that conversation with your manager if you feel you will be in a position that you'll need to carry over.
Thanks, Jen. I'll now hand back to you, John. We haven't had any more questions come in the chat or via the comms team. So if I could hand over to you, John, to sum up today's session and to close us down.
Thanks very much. Yeah, thanks everybody. There's some good questions there, and particularly from a sort of culture and values point of view, just to go back to the new starter question, not to reiterate it, but that sense that it's okay to say we don't always get things right, and we are human, we do miss things, and if there are things that haven't been fixed or are issues or we've done wrong, just keep telling us, and because that's the environment that we all learn from, isn't it? And I think it's really important. That was a really good question, and for once, something relatively simple to fix. So yeah, short and sweet session today. Just to reiterate my thanks to everybody for what they're doing presently. We'll, as I say, the more we get to know the details of the new variant, we'll obviously include that in the messaging, because it'll be important to know what our response needs to be. But thanks for everything that you're doing in terms of why we're all here to provide the best care we can for our patients and service users. And I'll let Anne-Marie be able to get on with her lunch. Thanks everybody. Have a good afternoon.